You're listening to Someday List, a podcast by To Do. Every month, we're sitting down with some of our favorite creatives, founders, and entrepreneurs to talk about what they're doing, how they got there, and what they want to tackle next. I'm your host, Evan Leon, and today I'm talking to Fatimah Loren Dreier, Executive Director of the Health Alliance for Violence Intervention, an organization that fosters hospital and community collaborations to advance equitable care. Fatimah has dedicated her career to addressing the epidemic of violence in America. And today we're sitting down to talk about violence through a public health lens, her work advising the White House on this crisis, and how to think about and tackle big problems. But before we get started, if you're looking for an easy way to get organized, look no further. To Do is a thoughtfully constrained minimalist to-do list app that is as simple as paper. Because we believe that simple stays organized. To Do helps you focus on the things you need to get done so you have more time for the things that matter. Start your 30-day free trial at todo.com or download the free mobile app. On to the interview. Fatimah, thank you so much for being on the podcast today. How are you doing?
I'm doing great. Thanks so much for having me.
Let me start off by saying congratulations. Earlier this year, you graduated from the Yale Executive MBA program, and you received the Dean's Award for Mission and Impact. First question, how does it feel to be done with all of that?
Thank you so much. It's an incredible honor and a huge accomplishment, so really appreciate it. I've been dreaming about completing an MBA for many years, and while I was in the program, even at the most difficult moments, I loved every moment of it, and it feels wonderful to check that off my to-do list, so to speak, and it also is wonderful to have more time. I also got married right before the program started. And so it's been wonderful to spend more time with my partner. But it was an incredible experience, a lot of wonderful community that was built, I think, especially to be at a institution that focuses on business and society during a time when we were experiencing a global pandemic. And I was in the healthcare track. So I got to speak to leaders across the country at a time when everyone was calling upon leaders to not only devise strategy, but execute strategy. So it felt like I was there at the right time and got to be around people who were doing incredible things. So I feel really lucky.
Do you think you've sufficiently scratched the academic itch for yourself? Are you leaving the door open or you're good for now?
Loved ones in my life will say, and I think they're right, that I can never fully close that door, but I think the itch has been scratched for now, but I never say never.
In addition to that, you, prior to that, already had a master's in counseling psychology and global mental health. I'm interested in the global mental health piece of that because I think that sort of informs the work that you've done in your career. So I'd love to talk a little bit and dig into HAVI, the Health Alliance for Violence Intervention. Can you tell us a little bit about the organization and the work that you do there?
So I lead an organization that helps stand up a model of care called hospital-based violence intervention. And it's a model of care devised over decades that was championed by trauma surgeons, former patients who were gunshot wound victims, people who were seeing on the ground that violence in America, gun violence in America, is cyclical. So they were seeing that people who've been violently injured, who've been shot, who come into our nation's hospitals, they're treated for their physical wounds, and then they are discharged and go right back out into environments that have not fundamentally changed. And as a result, unfortunately, are re-injured, and their risk of re-injury is somewhere like 30 to 40% risk of re-injury. And so they return to the hospital, either injured again or unfortunately sometimes fatally wounded. And this trend has existed in the country for quite some time without any major push to address these issues, to better research them, to provide a suite of interventions that can make a difference in the lives of those who are violently injured. It's really about addressing some of the fundamentals of healthcare. Unfortunately, this has been an issue that's been woefully neglected. So what I do is I've really helped take a model that was providing support to violently injured patients, a behavioral model that addresses some of those root causes of violence and was found in some randomized controlled trials to help actually mitigate the impact of violence taken that model and helped scale it in the United States and increasingly internationally. I'm very proud of that. So that's what I do. And there are a number of ways in which we do that, but essentially that's our work.
When we have these conversations, we deal with the injury and not the confluence of factors that contribute to it, that lead up to it. What are the symptoms that you're dealing with beyond the physical injury?
Well, let me start by telling you a story. It's about a patient, Sherman Spears. He was shot in Oakland, California in the 90s. His wounds were quite critical. Unfortunately, he was bound to a wheelchair following his injuries. And while he was in the hospital, and he was in the hospital for weeks, doctors and nurses would come and attend to his physical wounds. But visitors who came were people from his community in Oakland who were asking him whether they should retaliate, given that he'd been harmed. And he realized that the doctors and nurses had no idea about the trauma and the fear that he sat with every single day in the hospital about what was going on outside the hospital doors in his community. Once he healed enough to be discharged, he decided he wanted to change his life. He got connected to youth programming that he'd already been involved in and enlisted the doctors and the nurses to come back. And again, he's in a wheelchair, come back to the hospital to speak to other patients because he knew that speaking to them about what it means to have been shot, the trauma that they're experiencing, the fear about their own safety, the concerns they have about their loved ones who might be future targets, who may already be in danger. He was uniquely positioned to share his own experience and address some of those core concerns and mental health challenges. And in doing so, help new patients recognize that there were things they could do to help them work through some of the fears they had and very understandable trauma, acute stress that they were experiencing. So at its very early stage, the foundation of our model is really bringing people to the hospital who understand, who have some lived experience to share peer-to-peer. And we find this throughout health and behavioral health, that hearing from credible people who have experience with the particular issue that you face is an incredibly effective way of transmitting messages, especially messages that have to do with one's wellness and health and mental health. That idea has scaled in this country, and it has led to incredible studies that demonstrate the effectiveness of those messages and addressing mental health challenges. We see shifts in behavioral outcomes such as substance use, alcohol use, anger issues, that people who are hearing these messages and are engaged in this sort of support, we see decreases in their risk. And it's incredibly powerful. So it's not just about saying this is a mental health issue. And I'm not saying they're doing clinical care, right? There's still a role for psychologists and social workers. But alongside that, having a credible messenger to relay some of those messages, an enormously powerful tool in transformation.
I'm curious, how do those early conversations with a hospital system or a facility go when they're contemplating whether they want to implement something like this? From the outcomes, it would seem like a no-brainer. Are there ever barriers to it?
As you can imagine, the healthcare system and hospitals have a significant task. They're tasked with addressing a plethora of health issues and needs of patients. And as I said, this has unfortunately been an issue that's been woefully neglected. So when we approach a hospital and we recommend that they start a program, we often need clinical champions first. We need the trauma surgeons, the emergency physicians who are seeing the patients. We really need their buy-in first because they're the ones that are going to be able to share stories about what they see in the trauma bay and share that this is an idea that they've seen at other hospitals. They've talked to their colleagues in other places that are implementing this. We find that peer-to-peer relationship is also really important. And to share the value of providing these services to patients, that it's just the right thing to do. So that's the moral case. Some of the barriers there when you're making a moral argument for providing health services, the challenge we find is that people often think of violence as purely a criminal justice issue. So to provide a reframe that it's a public health issue and that health systems need to be engaged, that's a significant paradigm shift. And so in the early days, you certainly saw a lot of resistance or confusion, curiosity, but certainly there was a real prevailing lack of knowledge about why violence would be a public health issue. That's changed over time. Just like any innovation, it takes time for early adopters to really spread the word. Mm-hmm. So that's on the moral side. This is the right thing to do. There is also a business case for this. Violence is expensive. By some estimates, it costs the United States $280 billion annually. For those who are violently injured, some of our cost analysis per patient, we're looking at $30,000 or $40,000 in terms of treatment. Some of it's reimbursed, some of it's not. Most of it's not. So there's a real concern around the cost of violence, the real cost of violence. And for us, there's been a real march towards how to build a business case for violence intervention strategies. And we've worked for many years, and I'm really proud to say we've really succeeded in building a business case. We've secured billions of dollars for this work in the United States. I advise and support the Biden administration, not only supporting the president in communicating to the country the value of this work and the Domestic Policy Council communicating the value of this work, but also the reimbursement structures that are required to sustain this work in hospitals. And so we have worked with CMS. We are currently working state by state, Connecticut and Illinois being one of the first states to offer a reimbursed benefit related to violence prevention services. And now we're in 6 states and it's expanding rapidly. There's some real opportunities for that reimbursement mechanism that makes it sustainable, that makes it a business line, just like every other line. When heart attacks happen, there's a business line you can reimburse for it. You can pay people for their work. So we really care about both. We want to make those arguments, both of them, strong. There's also this larger prevailing conversation about racial equity in our country and health equity, and recognizing that it's important to acknowledge that this has been neglected. Violence is the leading cause of death for Black boys and men. It's the second leading cause of death for Latinos. And that's been the case for quite some time. This is not new. That the neglect to address this pandemic, right? It's an epidemic that has been narrowly impacting communities of color. It's no coincidence that it also has been a particular set of issues that haven't received the kind of focused attention and innovation that other health issues have. And this is something we want to say explicitly, that racial equity is important here. Health equity is really important. And that if we address these well, we transform communities, not just the patients, but we're looking structurally about how we can make changes in communities. So that's really exciting. So we talk about all of those things. We're not just convincing the hospital administrator. We want to impart the value of this to the mayor, to the governor, to senators, to the president. And we work at every level to ensure that this is a value. It's a value that we have in society.
This interview is brought to you by To Do. You're juggling a lot and you don't know where to start. We've all been there. And that's why we made To Do with the core belief that less is more. To Do is the minimalist to-do list app to ease your cognitive burdens. We are the most refreshing task manager in a sea of monster energy drinks. No pings, no feeds, no comments, just you and the things you need to get done in a simple, intuitive interface. Use code SomedayList for 20% off when you subscribe at TEUXDEUX.com. Back to the interview. I wanted to ask you about your trip to the White House, your work advising the president, and that $5 billion commitment and plan to address gun violence. One, I was just curious, what was the process of that all coming together, and what does that sort of empower HAVI and organizations like it to do? And then two, How did it feel for you personally to see the president using the platform of the highest office in the country to say these things out loud and actually make that commitment?
Yes, I can remember being invited for the first time to the Rose Garden. And this was, at the height of COVID, right?
Hmm.
So we're there getting the call that we were invited, that we were expected to be masked and rigorously tested, that it would be a small group, but that the president wanted to address through a press conference to the country conversation about violence. I will never forget that day. It was
Hmm.
incredible to sit with not only survivors of violence, but advocates who'd been on the front lines of this issue for many years. What we're working on is building an ecosystem. We want patients and patient advocates to be involved. We want providers, the doctors who are giving care to be involved. We want payers, right? Those who are going to pay involved. And to have all of those players there and to know that I played a role to organize and synthesize disparate views and information that was needed to make the strongest case we possibly could. It was really powerful and personally incredibly fulfilling,
Hmm.
and that it was really received and heard. And this president has had an interest in and a passion for addressing violence for many years. When he was a vice president, I had the privilege of providing briefings then. So, my policy work extends, and many others have extended for quite some time. So there's a lead up to this, but then there's a moment, and that moment still requires a lot of precision and a very clear argument backed by data, backed by a real understanding of the different ways people see the issue. So it needs a really strong but nimble. In other words, you got to be able to make your case,
Hmm.
but recognize that the wrapping it comes in will need to be flexible based on the needs of the moment. I've been honored to have gone back to the White House many times to have conversations and to support this administration in continuing to find opportunities to transform healthcare and, in particular, secure violence as indeed a public health challenge. And that day in April of 2021, when the president announced and said very clearly that violence is a public health crisis, it was incredibly moving. And I remember following that, I had an interview with NPR. And I said that. I said I was
Hmm.
just so moved. We've never had a president say that so clearly and to announce what he was going to do to address the crisis. It's very powerful.
Especially in a time when gun violence is highly debated or politicized in a way that can distract from the real human impact. Hearing it from the White House is a great start, but how do we shift the general public's understanding of this issue from talking points to understanding the problems and their root causes?
It's the $1 million question. I really appreciate that. And, I do think that we have examples in history of shifting our perspective about something in such a way that new ideas and opportunities become available to us. Pull from those examples and you leverage them and you articulate a new path forward. On the health side, things like the transformation of tobacco use in this country. If you remember in the 40s or 50s, you'd see cigarettes everywhere. People are smoking in hospitals and,
Yep.
you um,
Airplanes.
in airplanes, and we've got ads with everyone. It's cool to smoke.
Uh-huh.
And that's shifted significantly. And it's taken a slate of both research and new ways in healthcare, I think, to address cessation and marketing and ads. It takes a whole host of things in order to make this possible. But you first have to understand current sentiment. And I think it is something we don't fully understand. And we just released actually a national poll that explored some of the sentiment. We did this in partnership with Data for Progress. And we were actually very surprised to learn, a number of things. So we asked, for example, what are people's prevailing views about gun violence? And we found 50% of African American and Latino communities were concerned about violence in their own community. That's a significant number. And for white Americans, 1 out of every 3 are concerned about violence in their own community. So this is, as you said, this is not a quiet issue. This is something that a significant portion of the population is thinking about. Let's look under the hood there. What do people see as possible solutions? And we found that 46% of the sample polled believe that addressing root causes of violence, so trauma and poverty, were going to be fundamental to changing gun violence in the country. This is really significant because it's actually more of a structural analysis of the needs. It's about addressing things like mental health. That's a great place to start. That demonstrates that actually some of the work we've done in making that case is actually resonating with voters. And then we have upwards of 60% of likely voters who say that they actually support funding this work, that they want to see more resources, they want to see Congress act. And I, again, think that is very powerful, that these are not foreign ideas or so novel, only a small part of the electorate knows about, that we've not only made the case, but we are making it over and over again. And more people understand what it means to provide health approaches and are beginning to support those. And that's how change happens. You begin to see it out in society, that demand increases, and then change happens. So it's really exciting. I think there's far more to do, but it's a great start.
I've heard you describe your work as being at the intersection of health and racial justice, and that you happen to work in violence. Can I ask why you describe it that way and what you mean by that?
I am an African American woman. I grew up in a community that was ravaged by violence and poverty and low educational attainment. There are a range of issues that one can address that would be worth a lifetime of work and be good, excellent work. I do think that my path to working on violence in particular, I can point to antecedents. My father has been in and out of prison most of my life. First had a gun put to his head when he was a child. I witnessed him being arrested. I've seen him in street fights. These are among many other challenges that existed in my community and were completely normalized. I could have grabbed any one of these issues. What I really appreciate about addressing violence is the level of neglect I think it's had in society, the opportunity not only to address healthcare through a particular lens, think about a rare disease, so to speak, like something that affects a small number of people, but is really expensive, really impactful if you address this issue. So you can kind of wrap your arms around the people who are affected by it. But it also helps build a new workforce. We have created a new code and a new workforce that is able to provide and deliver the model. And so it's given me a unique opportunity to actually from scratch build an ecosystem and create jobs and bring the kind of scale that can actually have significant impact. We often point to Oakland, right, who were an early adopter of many of these models. They boasted a 50% reduction in violence by implementing these public health strategies. It's incredible. And they were on track to continuing that decline had not COVID happened, where then they had to freeze all of the professionals that were deployed to do this work. They were immediately frozen and weren't able to do their work. And so it just gives you a sense that there's something real here. And so that's what keeps me in it. You never know those turns in your career, but then you're just grateful for them as they emerge.
Like you said, any one of these things at the intersection could be its own mission that a person dedicates their life to. And you're tackling all three. When you are thinking about big problems, big seismic shifts in thinking, how do you even begin to figure out what do I need to do day to day? How do you start making a plan?
I really get into the weeds of any big problem. How do you eat an elephant? You got to do it one bite at a time. I hope I got that
I think that's
right.
it. Yeah.
um, there is an enormity, and it's very easy to get stuck in how big this is, how big the problem is, how big the opportunity is. And at some point, one needs to translate big ideas into digestible, practical, operationally sound, and strategically sound action steps. I happen to really love doing that, and it's a strength of mine. But I will admit there are days where it can really feel, I can feel the kind of enormity of the task at hand. And my secret is to get out of the office, go
Mhm.
for a walk, take some time away from it, and open myself, open my lens a little bit. Somewhere in the recesses of my mind, that operational brain just begins to order things. And what I really love about that is when those insights come, here's how I can lay this out, like step by step. I want no friction between me and getting that down on paper. I
Mhm.
want to be able to articulate, as raw as it is, the ideas and the steps, the operations, and, grab my phone and just kind of go for it. And that, I think, has been the real gift of technology one. And these last few years is having that spaciousness. COVID's been really hard for a lot of reasons for a lot of people. We did a lot more outdoor activities because going indoors was dangerous, right? So just doing a lot more walking and processing. I've had the most epic sized to-do lists, just tomes and tomes of ideas. And my staff know that I'll have these big ideas, and it's like, okay, I've had some thinking time. Well, okay, here it comes. And I will just lay it out. Like, here's the things I'm thinking about. I offer this to people who might be in a similar situation. There is really no problem in the world that doesn't have a first step. And I think that sometimes it can feel too small, but I find the muscle of taking the first step creates the opportunity to take the next step. Sometimes people think they need to know all the steps before they start.
Mhm.
I've never found that to be true. I mean, you think as much as you can. I'm not saying take a walk without looking both ways before you cross the street.
Yeah.
Right? I think that analysis is really useful, but it's often the case, especially with these large problems, that you'll need to take a few steps first and then reassess. And what you discover there is going to be different than what you knew a few steps ago. And you're going to have to just step out on faith or step into that uncertainty and be willing to tolerate that uncertainty. People are very comforted by big, thoughtful plans that become obsolete the minute you begin implementation. What I'd rather have is a set of assumptions that I constantly check in on, and then a really refined set of tasks that will get you enough along the way that you can then reassess your assumptions and reassess the landscape. And that nimbleness and strategy, I think, is a winning way of doing things when you're tackling something big.
So, with this commitment from the White House, I imagine HAVI and organizations like yours, you're going to be in operating mode for a little bit and starting to implement everything that commitment entails. But I'm curious, is there a next item on your someday list?
Yeah, I mean, definitely, I've got more than enough on my plate at the moment. But I will share that my husband and I just went on vacation in Morocco. It was beautiful. And we were at a concert, a jazz concert, and I used to sing, I used to perform. And at his nudging, I was invited on stage to sing with the duo, and it was so much fun. And it just reminded me of how wonderful it is to have art and creativity in your life. And so on my someday list is perhaps finding a band or, and particularly like a jazz pianist to work with and to get out there and perform someday.
I
Someday.
absolutely love that. Fatima, thank you so much for your time and your expertise. If someone wants to learn more about HAVI and the work that you do, where can they find out more?
You can visit us at our website, www.thehavi.org. And you can also follow us on Twitter at thehavi, TheHehavi. We're always there. So we'd love to connect.
Thank you for tuning into another episode of Someday List. We'll have new episodes for you every month, so make sure to follow and subscribe wherever you get your podcasts, or follow along on social media at To-Do App on Instagram or Asked To Do on Twitter. This podcast is produced by To-Do. Our theme music is composed by Evan Laybourne. I want to thank our guest Fatimah for coming on again, and of course, thank you, the listener. We'll catch you next time.